Hi everyone, I am Dr. Palanki Satya Dattatreya, Director and the Chief of Medical Oncology Services at the Renova Soumya Comprehensive Cancer Center in Secunderabad in Telangana State. I am here today to represent the Renova Soumya Hospital and give some important take-home messages regarding breast cancer, regarding the early signs, symptoms and signals of breast cancer, which will help us in diagnosing breast cancer early, regarding understanding that 5 to 10% of breast cancer cases can be caused by faulty genes, by inheriting some faulty genes which can be transferred in families, say from mothers to daughters, and that therefore gives us an option to make sure that do we have some strategies to prevent or tackle breast cancer at the earliest. Lastly, I would also like to give some important tips regarding how to prevent breast cancer. Let me start by telling how to prevent breast cancer, because breast cancer more or less can be regarded as either a lifestyle disease or something to do with some hormonal imbalances. For instance, some risk factors which have been noted to be associated with breast cancer are early menarche, the first menstrual periods happening before the age of 11 years, for example, or late menopause, which means the menstrual period stopping in females after 55 years of age, or no pregnancies, nulliparous females, or first live childbirth after the age of 30 years. Similarly, obesity, using some hormone replacement pills which contain some estrogens and progesterone containing preparations. In addition to that, some oral contraceptive pills also which contain some hormones which might be a risk factor for breast cancer. Additionally, 5 to 10% of breast cancers happen because of inheritance of a faulty gene, namely BRCA1, BRCA2 and some others. So it's important to maintain a healthy weight, maintain a healthy lifestyle, have a proper, healthy, hygienic, balanced diet, avoid obesity, especially after menopause, and make sure that vitamin D and other naturally occurring antioxidants and a good diet which contains lots of green leafy vegetables and colored fruits can go a long way in preventing breast cancer. We all know that various risk factors can cause breast cancer, though we don't really know one single cause. Like for instance, tobacco smoking causes lung cancer, tobacco chewing causes head and neck cancer, or the human papilloma virus causes cervical cancer. With regard to breast cancer, it's usually a conglomeration of some risk factors which might be responsible for causing breast cancer in that particular individual. 5 to 10% of breast cancer patients happen because of a faulty gene, because of the gene getting transmitted in families in generations. One such gene is called as the BRCA1 gene, BR standing for breast and CA standing for cancer, so BRCA1 gene, and the second is a gene called as the BRCA2 gene. 5 to 10% of breast cancers happen because of this inherited predisposition of the BRCA1, BRCA2 gene getting transferred from the mother to the daughter. One famous example of such inheritance is the Hollywood actress Angelina Jolie. So BRCA1, BRCA2 or other genes might be faulty and they might be responsible for causing breast cancer, ovarian cancer in that particular individual who is having that gene abnormality. What's important is to identify the families where the BRCA1, BRCA2 genes might be present and might be getting inherited. And so, when the BRCA1, BRCA2 gene abnormality is identified in a lady who actually has no symptoms, no signs of breast cancer, then it's important for us to prevent the development of cancers. Most importantly, to identify the development of cancers early on so that we can tackle and cure these cancers. More importantly, I think all of us realize that cancer is curable if diagnosed early, and then also if treated appropriately. In fact, early breast cancer has a cure rate which exceeds 90 to 95%. It's important therefore that we don't miss the early symptoms or the early warning signals of breast cancer. So what are the early signs, symptoms or signals with which a breast cancer patient may present to us? Number one, a lump in the breast or a lump in the axilla, in the armpit. Usually breast cancer lumps are firm to hard, painless initially to start with, gradually increasing in size, and the relationship of the increase in size is not at all connected to the menstrual periods. Number two, any thickening of the breast or any swelling of one of the breasts, change in the shape or size of one of the breast when compared to the opposite breast, nipple discharge, especially if it's a bloody nipple discharge, and in women who are not lactating, if we find thick nipple discharge, this symptom should not be neglected. In addition, you may find that there might be involvement of the lymph nodes in the armpit or sometimes above the collarbone. There could be some thickening or some retraction of the skin, sometimes manifesting as nipple retraction. So these are some of the common early signs, signals and symptoms of breast cancer. Approaches by which we can do. One is to prevent by doing a risk reduction surgeries, and that's what Angelina Jolie did. For instance, if there is a BRCA1 or a BRCA2 gene mutation present and the patient is completely asymptomatic and the person is completely asymptomatic and does not have cancer, either breast cancer or ovarian cancer, then we go for bilateral mastectomy, which means no breasts and therefore no breast cancer. Similarly, bilateral salpingo-oophorectomy, which means no ovaries and no ovarian cancer. However, this is an extreme step, but these are called as risk reduction surgeries. Surgeries done to reduce the risk of developing either breast cancer or ovarian cancer. The second way, what persons having the BRCA1, BRCA2 mutations present could be by going for regular surveillance, close follow-ups, so that regular checkups are done by the clinicians, by their local family doctors, and timely examinations with regard to investigations like, say, ultrasounds or an MRI and some blood investigations. Lastly, some chemopreventive strategies also are there, using some drugs which can alter the natural course or the natural history of the disease development in that particular person who has the faulty genes. So it's very important therefore to make sure that patients of breast cancer and ovarian cancer, and in fact even prostate cancer and pancreatic cancer, should get the BRCA1, BRCA2, etc. genes tested so that we can identify the mutations and accordingly make sure that the patient benefits from this knowledge. And more importantly, the relatives, the brothers, the sisters, the children and the parents also can get themselves tested to find out who all are afflicted with the BRCA1 or the BRCA2 or other inherited gene mutations. Thank you so much.